Concussion update for physicians and clinicians.
Hello, I'm Dr. Kevin Kaplan, head team physician for the Jacksonville Jaguars. Thank you for taking a few minutes out of your day to view this short video on sports-related concussion. As you know, concussions are a hot topic in the NFL, a league we are fortunate to surround our elite athletes with very dynamic medical staffs. In your practice as a community physician, the challenge can seem sometimes overwhelming, especially when it comes to evaluating and managing a young athlete who has sustained a concussion, in particular when it involves a return-to-play decision. In 2012, Florida enacted a law for youth sports-related concussion that has required any youth athlete suspected of having a concussion to be immediately removed from play and cleared by a physician prior to returning. With a number of kids participating in our sports, it is important for our community physicians to be prepared to evaluate and manage concussions. Dr. Mickey Collins from the University of Pittsburgh Medical Center is a renowned expert in the field of sports-related concussion. Dr. Collins is going to share extremely important information for you to increase your confidence in managing a sports-related concussion case. Thank you for your attention to this video and your care of our young athletes.
What is a concussion?
The word concussion literally translates from Latin to English to mean to shake violently. When the brain moves inside the skull, there's a variety of chemical changes that occur to the neurons and the cells in the brain that can result in upwards of 22 different types of symptoms we see from concussion. Concussion can simply be an athlete who is dizzy, has a headache, is tired, is light sensitive, noise sensitive. They may or may not lose consciousness. They may be sick to their stomach. We may see mood changes. We may see sleep issues after the injury.
Diagnosis, prognosis, and recovery from concussion are all directly connected with symptoms. Can you explain further?
When we look at recovery from concussion, there's a variety of things that we have to look for. Number one is the athlete having any symptoms of the injury? And these symptoms can be very subtle. Even athletes who are tired at the end of the day more than normal, or they get dizzy when they stand quickly. They may not have a headache in the morning, but they get a headache as the day goes on. They may have difficulty focusing in their classwork. They may have mood changes. They may have sleep problems. The symptoms of concussion can be very tacit, but it's very important to understand the subtleties of the injury. And any changes in behavior may indicate that a concussion has occurred.
Clinicians are sometimes under pressure to return kids to sports by parents and coaches. What must the clinician do to best protect the athlete from further injury?
The clinician needs to be trained in how to ask the right questions of the injury and to really understand, again, the subtleties of the injury is so important to make sure the athlete is truly symptom-free before we put them back to play.
How long does it take a young athlete to recover from a concussion?
Recovery from concussion is a highly variable process. Our research shows that about 40% of kids in high school will recover within a week, about 60% by week 2, and about 80% by week 3. That means that 1 in 5 athletes will take more than 3 weeks to recover. Again, some athletes may take a couple days to recover from the injury, some athletes may take several months or even longer. It's a highly individual process and needs to be monitored very carefully.
What is the recommended treatment for concussion?
The first recommended treatment is, when in doubt, sit them out. And when an athlete has any signs or symptoms of concussion, they're taken out of play. That's number one. Number two is, when the athlete has been diagnosed with concussion, we want to make sure we don't overwhelm the patient environmentally, or we don't want to exacerbate their symptoms with certain specific activities. A lot of times that includes school. We have to be careful not to make symptoms significantly worse, especially within the first few days of an injury. I would not suggest complete cognitive or physical rest from this injury, but we certainly need to be mindful of what activities make symptoms worse and be careful in monitoring those activities.
Is there anything we can do to speed the recovery process?
If you can avoid exacerbating symptoms early on with the injury, we can actually get the patients better faster. We don't want to put someone back to physical exertion before they're ready to do so. We want to make sure that school is monitored very carefully. In short, we want to monitor each athlete and make sure they have the right pathway to their recovery, and you can improve outcomes that way.
The FHSAA has a great form to help guide the return to play process once cleared by a physician. But what guidelines can you provide to physicians to make sure the athlete is ready to begin this initial return to play?
The athlete has to be completely symptom-free, and that means all 22 signs and symptoms of concussion. They need to be completely symptom-free at rest. They need to be symptom-free at the end of a school day or following school. they need to be symptom-free with exertion, and if available, they need to be within normal limits with the objective tools that are used to measure injury, such as computerized neurocognitive testing. So symptom-free at rest, symptom-free with physical exertion, symptom-free with school, normal neurocognitive functioning. Those criteria are well outlined and really the standard of care now in terms of managing concussion. And it's important that they achieve all those marks before return to play.
For more information, visit fhsaa.org, cdc.gov, or jsmp.us.